My name's Austin Bland, and I'm a genetic counselor at Fred Hutch. I work at the Paulsbo location for Fred Hutch, and I also work at the South Lake Union location, so I get to see patients at both. When it comes to routine screening, there's definitely guidelines in place regardless of your family history, when people should be getting screened for things like breast cancer or colon cancer or any number of different cancers. And those guidelines can be followed regardless of somebody's family history. But family history plays a role in somebody's screening. And so if there is a family history of some of these conditions, then the oncologist or the doctors will adjust those screenings to be appropriate for somebody's family history. And it's actually pretty common that we see people who are adopted or just don't know much about their family history. And in those instances, we can still do genetic testing in people, especially if they themselves have a history of cancer, but we can still do genetic testing in people regardless if we know their family history or not. There's a lot of different genetic conditions that people can test for, but Fred Hutch specifically, because it is our expertise, we focus on those cancer conditions. So, hereditary breast cancer, ovarian cancer, colorectal cancer, pancreatic cancer, those types of things. So there's a lot of different ways that we can do genetic testing. We realize that blood tests and coming in person isn't always feasible for folks. Blood tests is one way, but we can also do saliva kits that are sent to people's houses so they can just essentially spit in a tube, and 2 to 3 weeks after that we can get the results back. Or a cheek swab. There's a number of different ways. Or if people have diagnoses that are more of a blood cancer like leukemias or lymphomas, we can offer certain types of skin biopsies as well. So there's a lot of different options. And it helps with folks who, are definitely, like for example, out in Eastern Washington or in some of those areas where it's not as easy to get to a Fred Hutch location, we can just send them a saliva kit and then it will appear in the mail within a week essentially, and keep the process going. A lot of different providers can order genetic tests. I do know that genetic counselors do have specific training when it comes to exactly what tests to order based on somebody's personal and family history of certain conditions and certainly cancers. We can do genetic testing for a lot of different conditions, not just within cancer, but in general. And one of the important tools that we can use to make sure that we look at the right genes is family histories and knowing people's personal histories of cancers in this instance. To do a bigger genetic test in more people wouldn't necessarily always look at the right genes. So the best way to do genetic testing and make sure that we're looking at the genes that are the most relevant for somebody's family history is to have them come in and see a provider so that they can be kind of hand selected. It kind of depends. It depends on the family history, it depends on the personal history, how the genetic tests work. We look at a lot of different genes. Some of those genes are more related to some cancers than others, but there's a lot of overlap in the genes that are related to certain cancers. So for example, the genes that we look at that are related to brain cancer are oftentimes related to other cancers as well. There's not necessarily a way to just check off only the cancers that you're interested in looking at, but we can, to some extent, based on somebody's comfort, change the size of the genetic tests that we do in order to only look towards specific types of cancer, but can't really focus on one particular condition. This is an important question and one that we get a lot. So if somebody has, a BRCA2 mutation or a variant or a BRCA1 variant, oftentimes folks will really want to get their kids tested. Generally, as providers, it's recommended that when these kids get to be adults, 18, 19, then they can make the decision themselves to get genetic testing if it's something that they're interested in doing, because they'll have the autonomy to do so at that time. And because screening for people with a variant in BRCA1 or BRCA2 or BRCA1, BRCA2 is recommended after 20 anyway. So typically we just say wait until a child is an adult and then they can choose if they want that genetic testing, because it can be a lot of information to have when you're, a little kid or a teenager and knowing that these risks are coming up. I mean, genetics is a family affair at the end of the day. So when we do genetic testing and if we find something like a pathogenic variant in one of these genes, we recommend that people share it with their families. And you ask exactly who, but certainly first degree family members, so like kids at a certain point, of course, parents, siblings, and then even outside of that, sharing with the rest of the family, aunts, uncles, grandparents. It helps for them to go to their providers to know their full risks or to know their risks for developing cancers. Essentially share it with all of those people in your family that you feel comfortable sharing it with, because it can only help them in their health care. At the end of the day, somebody's personal and family history of cancer is what really matters the most. I would just recommend that if people have a family history of cancer, a number of people in their family with cancers, that they contact the Fred Hutch team, the genetics team, and have a consultation, because that's the easiest way to know for sure if you qualify for genetic testing or if it's something that would be helpful.